National Agency for Food and Drug Administration and Control said 8 officials smashed a syndicate posing as free healthcare providers in Abuloma area of Port Harcourt, Rivers State. The agency said the syndicate also posed as missionaries to give fake and unregistered products, including tablets and eye drops, saying a woman, Mrs. Gladys Theophilus, seen administering the product was arrested. The director, South Zone of Nafdac, Chukwuma Olibu, disclosed this while briefing newsmen in Port Harcourt on Monday. Olibu said the arrest followed a tip of Nafdac received from some concerned citizens on the activities of the suspect at a town hall in the area, leading to the raid last Friday. He said the products which they claimed treat several sicknesses neither had a Nafdac number nor the address of the producers. The unregistered products includes Evangelist Jenkins Supernatural Water, Evangelist Jenkins Cleanser, and Evangelist Jenkins Eye Drop. These products are purported to treat cancer, pile, arthritis, rashes, fibrosis, cataracts, and glaucoma. The list is limitless, as the statement stated. I don't want to laugh over this. This is actually hilarious, and we know that most Nigerians are victims of this scenario. I want to get your thoughts on what you make of this, please.
Do I say it is the ignorance of the citizens? Ordinarily, the last time I was on this same station, I told you about where I visited in Lagos. In course of crossing the road, I saw so many vehicles parked somewhere. And what are they doing there? I was told that those of us who have bad hair that there is this particular product that is being sold there. And because they said your hair will grow, vehicles were just being parked, people were just rushing to get those products. And I got there. All of a sudden, I excused the lady who was in charge. I was like, madam, what's actually going on here? She said, hey, people are rushing it to better buy now, it will soon get finished. I'm like, how? I said, okay, please, there's something I want to discuss with you. She said, say it here. I said, no, come. I took her to a particular spot and I'm like, madam, what is the effect of this thing that people are buying? She was very shocked that she has been selling the same product over a year and nobody has asked this question. I said, man, I want to know what the effect of this thing is. And she got angry. I said, you must tell me. All of a sudden, the guy came, which was, I think that's the overall master. The man took me into his office and told me, he says, that the effect is that if your hair grows, that the binet will not work again. I was like, how? I don't want to, I'm in the national television, I don't want to say. He said, the binet will not work again. I'm like, how? He said, that's the effect. That's the effect. That people think that because their hair is growing, God has the nutrients he has kept there. If it's no longer there, there is no way you can bring if you want to do the, how do you call it, artificial, there must be an effect. So the guy now told me what happened, that if you do it as a man, your body will never come up again. You will just be like that, except you are using whatever. Even as you are using that is still not going to come up. Now what I'm saying is this: because of hunger, because of insensitivity, because of lack of orientation, that is why this whole thing is happening. You cannot just come to a community where you have doctors already that are in existence. You have people who are with a medical laboratory and whatever that they are, that they are being named professionals. And you are coming to tell them one church is doing one thing in the name of the church, evangelical, whatever is happening, the water is holy water. When once you take the water, you be cleaned, and they are telling you one evangelical, Jensen and all that, and people are rushing. Why are they rushing out? If you ask me, I will tell you it's because of the poverty level in Nigeria. Ordinarily, since it's a free thing, like they said, free medical outreach, everybody want to come. Those who are sick, who does not have money to take care of themselves, who want to be available, they want to make themselves available. And not knowing what the effect or making fundings for those who have come to consult the community heads or whoever that is in charge, not asking them what are the effect of these things, what are the benefits of these things, and why us? Why? Is Nafdac aware? It has to do with product, and there is no Nafdac number on this same product.
And now the other question has there been any case that certain medicines or drugs can cure fibroids and cancer, arthritis? I thought there are procedures that has to be taken when someone has to engage in most of those necessary administration and all of that. So, you know, looking at this, that should also tell you that there's no possibility that most of these medications are really genuine. And then we know how delicate the eyes are. Imagine going to somewhere, and this particular lady in particular is an evangelist. So it's a church gathering, and there's this thing about most Nigerians. I don't just want to say Nigerians, Africans, who believe that if something is coming from the church, then there's this genuinity in it, even though it's not verified. They will not want to ask questions. They'll say, oh, since this person is from the church, then there's no way this could be fake in what way soever. I also want you to throw more light on that aspect where Nigerians get to believe so much from a particular thing that they know might not be verified just because it's coming from the church.
You see, I must tell you nothing but the truth. You see, the problem we are having in in Africa, like you said before, is that I've told people self-righteousness is another thing. Serving God is a different thing. Then people coming to you when you know this is not their field. You know, you don't. Even the professionals, the medical professionals will never. I mean, professionals will never tell you that. What they call it, vitamin C can cure headache. No, they will not tell you that vitamin C can cure arthritis. No, they cannot tell you that vitamin C can cure fibroid. No, that's their field. It's their profession. There had never been a day I heard them as professionals, even on my own research, that I've ever heard them say that one pill can't heal that 3, 4 different 3, 5 1, 2, 3, 4, 5 ailments. No, I've never heard that. It shows unprofessionalism and it shows ignorance of the highest order for Nigerians to always have believed, not just this one that is happening. If you go to Rumokoro roundabout, for instance, now you see a guy with some kind of leaf, green leaf. You see him spread them on the floor, and people will now around him. He begin to tell you that this one is for manpower, this one is for glaucoma, this one. Where did you get this leaf from? Who verified them? Who gave you a license to operate? You see people, when once what they call muco is coming out of their eyes, hey, he's working. Like after a few months, you see them going blind. But to them, as at that time, you see people, because they are seeing things coming out of your eyes, you see people rushing them. Hey, you see more persons coming. That place is happening, you know. And that's the mindset we have as Nigerians until there is a symposium or reorientation on how we should understand and see things in this country before this dirty act will be put to stop. You must not believe because it's coming from an evangelism group or a church group. No, church is church. God heals, yes, and that is not dispute. God heals. He said, "Pray, and I will hear." He said, "Seek, and ye shall find." He is God. He said, "Call upon me, and I will answer." He didn't say, "Carry water and mix whatever that is inside and go and give to somebody and say he's healing." You are damaging this person's system. Do you know what the health condition of this person who you are administering these drugs to? What the health challenge is? Do you know the level of time that this person has gotten to? You don't know if this one is going to cause the person death. I have a colleague in the office. He was very sound. Everybody knows he has never complained of headache one day. But this guy died. When we met with the wife said that there is this herbal medicine they brought for him that he took. I think after the herbal medicine, he began to sweat. From sweating, the man left. Why? Nigerians, whoever that is in charge of this evangelical group, I'm asking Nafdac to not only leave them. They should deal with this class of people who is doing as if they are ignorant of the law. Because you cannot tell me that because you're a citizen, you now carry arm, for instance, and as they come to the street and start shooting at people. It's more like killing people. Because it is a profession you don't have any idea. The lady, from what I heard, was being consulted and was asked a few questions. She said she was not a professional. She was not a medical personnel. So why are you administering drugs to people? She should be arrested. And Nigerians should also learn. They should know when and where to go when things like this come. Free thing kills in Nigeria. Even in Freetown, there's nothing free there now. Let us curtail how hungry we are. Let us curtail how eager we are to free things. That is my making.
All right, you talked about poverty, but we'll actually get to that point.